This is Tom Fox, and I would like to welcome you to the latest addition to the Compliance Podcast Network, Greetings and Felicitations. In this podcast series, I'm going to be visiting with thought leaders, entrepreneurs, historians, and a wide variety of other people on topics that are outside the area of compliance, but are of great interest to myself and to listeners to the Compliance Podcast Network. I welcome back Dr. Ben Locwin, who discusses with me the current state of the global COVID-19 pandemic, where we have been, and where we might be going. I know you will enjoy it. Hello, everyone. This is Tom Fox, back for another episode, and today I have back with me Dr. Ben Locwin, and we are going to catch up, I think, a little bit, hopefully, and then maybe look down the road of where we are with coronavirus, COVID-19, and the Delta variant. Ben, first of all, thank you for taking the time to visit with me today.
Yeah, hello, Tom. It's nice to be back and see you again and hear from you. I hope you've enjoyed your summer and the trailing proportion of summer that we're still in.
Well, that's interesting because this has been the coolest summer on record in the state of Texas. We did not have one day over 100 where I live. It's now pleasantly in the mid-70s to mid-80s, which is November weather for us. So I have the leaves started to change in your part of the world?
Yeah, so I'm in the Boston area, and we've got just the very, very first few that are sort of suggesting they may change. It's not really underway yet, but it sounds like global cooling in your area. We had a very rainy summer in the Northeast, too. A lot more rain than we almost ever have had. And I guess, summertime fact to warm us up for the chat here. So in the Northern Hemisphere, our summer includes the period at which the Earth is at its farthest point from the Sun in its orbit, and that's the aphelion. And so that's 94.5 million miles from the Sun, and when it's closest, that's the winter time for us in the Northern Hemisphere, and that's 91.5 million miles. So we're actually almost farthest away right now from the Sun, in case any of the listeners thought about the summertime occurring because we were at a closest point of orbit to the Sun. But with fall starting, next week, 22nd of September, 23rd of September, that includes the equinox, and with fall and winter brings us cold and flu season. So I know you didn't want to talk astrophysics today, but let's talk about viruses.
Well, the vernal equinox, and I got a text from CVS Pharmacy reminding me to get my flu shot, so it's all connected.
Right.
Apparently.
Perfect timing.
So we're recording this in mid-September. So Ben, could you give us maybe your assessment of where we are in the COVID-19 Delta variant status, and then perhaps transition over to your current thoughts on vaccination and particularly the booster?
Yeah, sure. So we've, in the United States, given about 383 million doses of COVID-19 vaccine to date. Now you know that with Moderna and with Pfizer-BioNTech, those are 2-dose regimens, and the Janssen vaccine is a single dose. So then you've got a separate statistic, which is, all right, so that's individual doses given. How many people are considered fully vaccinated, fully immunized, really? And that's about 180 million. So 55% of the United States is considered to be fully immunized. But yeah, as you said, the question really is about what does the media have to say to all of us about Delta variant? Should we worry about it? And I guess I would say let's think about it in terms of healthcare economics. And without going into a deep rabbit hole there, as the saying goes in virology, variant's going to vary. So the news media has been vociferously captivated by headlines of their own making about Delta and how it apparently came from Krypton. But even though that's dominated the headlines for a while, several weeks now, we've been quietly tracking other variants of interest and variants of concern. So it's, beyond Delta, it went to Greek nomenclature earlier this year. So right now we have other VOIs, which are variants of interest that are kind of more interesting than Delta. And those include Eta, Iota, Kappa, Lambda, and Mu. The Mu variant, which is an interesting one, is B1621. That one, uh, it really only accounts for about 0.1% of cases in the US right now. That one is one that actually popped up in January of this year, and it's one that it seemingly came out of Colombia and South America. And so I think that's the one that will start grabbing some more headlines. But again, that's really only about 1 in 1,000 cases at the moment. But back to your question, yeah, there is Delta, and more importantly, we're always going to see variants of interest and variants of concern. So I guess it depends where you want to go next with the discussion.
Well, I'm sure our Greek audience and our former frat rat audience will now be able to appreciate their learning the Greek alphabet. But you started off talking about the healthcare economics. What do you see really from the economic side in terms of a cost benefit analysis, or is there another analysis you health futurists use around healthcare economics?
That's a really good and interesting question. It's one of these things where in healthcare economics, a couple major indices are QALY and DALY. And those acronyms stand for Quality Adjusted Life Years or Disability Adjusted Life Years. And they're suggestive of situations where people are maybe more infirmed, but how many years or how much remaining time is left, and subjectively, qualitatively, what level of quality is that remaining time? So even though you may gain an additional few years of life, is it high quality, low quality? But just looking at economic indices as far as healthcare economics, we had a major economic downturn globally at the start, Q1 of 2020, obviously because of COVID. We've seen it slowly ratchet back up to now. The Dow Jones has a volume over 34,000, maybe 35-ish thousand as we speak now. And all the other global indices, so the Nikkei index and Shanghai and Italy, FTSE, those more or less tracked consistently with what the Dow is doing. And we got, I think, a supportive blip in the Dow Jones when the vaccines became authorized for use via EUA. And then, of course, in May, when the suggestion came from CDC that masks wouldn't be required, there was certainly a consumer confidence boost there.
So I have to take a short digression. You mentioned the news media and their theory that the Delta variant, or perhaps one of the other Greek letter variants, came from Krypton. So that really leads me to ask, are you an MCU person or more of a retro DC kind of comics guy?
I don't know. I guess now with how much Marvel we've seen in film, that's probably taken up more of my time. I think I've identified maybe more in the past with some DC characters. How's that for a little bit of do both?
Fair enough. I grew up, when I was very young, I lived with my grandparents, and my grandfather collected comics, and he was a huge DC fan. So in the 60s, I became a huge DC fan, and that stayed with me really until sort of the middle of the MCU wave, and I've tilted a little bit, but I'm still a classic comic collector, largely around the DC universe because that's the one I'm most comfortable with. But in terms of the economics going forward, I really wanted to see what are you seeing companies do? We've had some very public corporations take steps. Delta Airlines is one of the most public, where they encouraged employees to get vaccinated, and it said if they didn't, there would be a health insurance supplement per employee who was not vaccinated. There have been various other steps, both carrots and sticks. Have you seen anything that really intrigued you, or is that an approach that perhaps unfortunately is virologist you've had to see used in other situations.
Yeah, I've seen a lot of that being used. There are also the NPIs, the non-pharmaceutical interventions that still are effective: distancing, ventilation, mask use. But as people have broken away more and more from masking, been less concerned with distancing, it becomes more incumbent upon people to be immunized. So I think that's where really a lot of this has come from. The question about, and this could go any number of directions, but whether or not vaccine passports are a good idea or a terrible idea. I think workplaces are trying to do what they can to show to the public that they're managing their internal risks for their actuaries, but also that they're managing their organizations most responsibly for the consumers, so consumers won't be hesitant to fly on a particular airline or go into a particular coffee shop or other retail outlet because there won't be masks or there won't be immunizations there. So I think a lot of it has to do with optics. And, I think the flip side of that is getting beyond the pandemic requires systemic changes to our philosophy on this. If we always do what we always did, then we always will get what we always got, as the saying goes. So it's not only the more vaccinations, and carrot and stick, typically, right? The carrots work better, but not everybody responds to the carrot, but it's also the media cutting out the fear response cycles, which is a major substantive factor in drawing this out. It would be nice to say that the science is evolving and has evolved and operates in isolation from the media and social media panic, but that's not true. So I think, if I distill that down, what I mean by that is a lot of this is continued panic driven by the media about Delta, about then the next variant's mu variant, and people will continue to be worried, even though, let's say, in objective fact, we may get to the point where they shouldn't necessarily be as worried anymore. So I think there's a bit of panic that isn't scientifically suggested. And I guess, from there we get to the booster discussion, which is, do you do the boosters? Now, the White House administration, as you know, has been pushing for premature boosters to the public, and I say premature because the science really isn't clear, and it probably is suggestive of no, not yet, because we haven't lost efficacy and effectiveness in the current vaccines. And the White House pushing for boosters prematurely has actually led to two of Peter Marks's guys in the FDA being resigning, basically, their posts. And Peter Marks is the head of CBER, so they do biologics and vaccine approvals. So two of his senior guys who do vaccines, they have left as a result of the White House not listening to science. So it's interesting there. And so I guess I would also couch that in, well, then you have the people who haven't even vaccinated. And is it safe for workplaces to mandate it? And I would say the best info we have still comes from the clinical trials and then the real-world effectiveness. There was an analysis of 38 states and D.C. done, and it showed that unvaccinated Americans in those states were 5 times more likely than the vaccinated people to be hospitalized with COVID-19, and 8 times more likely to die. And CDC looked at data between May 1st this year and July 25th, so May, June, and almost all of July, 3 months. And it was for Los Angeles County, and unvaccinated residents were 29 times more likely to be hospitalized by COVID-19 than their fully vaccinated counterparts. So social media pockets and echo chambers have kind of taken to the flip side, as they always do, of, oh, we're not sure these vaccines are safe and let's cast continued doubt, when there's really not continued doubt in the collective mind of the scientific community. So, ultimately it does make sense, and what I've seen a bit more now, and what will come more and more out in the news, is there's an abuse of religious exemptions for getting the COVID-19 vaccines, because that's still allowed.
So let me pivot a little bit to a related topic, and that's the delivery of healthcare services. I'm in a state where bed percentage, ICU bed percentage is quite high. There are other states in the deep south that also have that problem. We hear stories of people who can't get either extraordinary or even routine services because of the paucity of beds. My mother-in-law spent 3 days in an ER waiting for an ICU bed to open up for her condition. And has that really led to a dialogue you are a part of or been aware of about our delivery of health service mechanism in the United States? Are healthcare services too localized, or are they designed? Are they fit for purpose now? That just you're going to get overwhelmed at times.
Yeah, it's a tricky question. So we do have lots of those discussions, and unfortunately, then a lot of those either aren't collected and collated up to a higher level for a larger, broader discussion, or they're so regionally distinct and specific that it sort of makes talking about, let's say, in Atlanta, Georgia, things that are happening in Cheyenne, Wyoming, less effective in terms of something you couldn't just put into place, plug and play from one area to another. And so the disparities, unfortunately, existing as disparities unto themselves, it becomes this kind of vicious cycle where then those individual circumstances are hard to port to anywhere else to resolve. So then there's not a collective answer, really, unless you kind of centralize everything, which would be, I mean, at this point, very difficult to do across the country, although, there are avenues where we could improve it. I think hospitals have always run that fine margin between when there is surge demand, they need to be able to have enough staff to tend to it so there's not a paucity of beds. And at the same time, when there isn't surge demand and you've got more, let's say, level, stable, lower demand troughs in your demand curve, now you've got hospital staff, support staff, administrative staff, and providers, of course, who aren't being fully utilized. So then it becomes a balance of how do you level load the schedule when, by its very nature, the emergency department is what emergent circumstances are popping up emergently. So difficult to plan for, especially when we've seen huge swings in demand with COVID cases. And then, of course, when beds are taken up with COVID-19 cases, that's facilities and resource that's unavailable for non-COVID triage, non-emergent care situations.
So, as we move into the autumn of 2021 and the winter of 2021 and 2022, you started out, or we started this podcast with a mention of flu season. Is there any concern about the upcoming flu season, and whether or not it might intersect with COVID or any of the variants, or do they really stand alone on their each levels of concern?
Yeah, they're sort of disparate concerns, but they're not disparate operating in isolation. So as the saying goes, nature abhors a vacuum, and these things don't work in a vacuum. So if you are compromised due to a prior COVID infection or compromised from an influenza infection, then you leave the door open for other adventitious organisms to maybe take root and cause you more significant concern. So generally the recommendation is get your flu shot, which is something we say every fall and winter. Flu season tends to be September-ish, more into October, and then carries through March into April. So it's about sort of that bottom half of the year from a calendar view into the top half. Flu tends to cause between about 5,000 and 45,000 deaths in the United States alone every year during cold and flu season. And so that's not nothing. Now, the flu shots tend to be trivalent or quadrivalent now, so they cover 3 or 4 different strains. And there is development currently by several of the larger manufacturers to put a combination flu shot in with a COVID-19 shot. So it could even be that towards the end of the year, what'll be ready for public consumption is a combined flu and COVID vaccination, which could be a booster plus the flu shot. And then again, of course, as influenza continues to mutate, that's why we get different shots every fall. We'll continue to see these other variants pop up that I mentioned. Soon the listeners will hear these in the news. And basically that'll continue. It always does, because as I said at the beginning, variants vary. That's what they do. So variants arise when new people, naive people, get an infection. The virus replicates, and that gives it new opportunities to mutate in a person and form new variants. So basically, by immunizing people, breaking that chain, we reduce the virus's opportunity to replicate and create new variants. And then when we're tracking these, so whether or not you hear about something next is sort of up to the media's appetite, but there's sort of three things we look at. Number one, if a new variant suddenly is more contagious and spreads more readily, that's what's going on with Delta. It's very much more transmissible than the first few variants. The second issue is, does it produce more severe disease? So when we see cases come in with, let's say, COVID-19 of a new variant, are they more severe, maybe moving quicker from minor to moderate to severe in its presentation of symptoms? And then thirdly, number three, does it have a composition so that it can evade the vaccines that we have? So when the virus looks different enough from what was built into the vaccines, then the vaccines won't be able to train our bodies to the degree to be able to detect a different enough variant. Now, we're not there yet, but there's no reason to believe that won't happen. So that's when the boosters would become more imperative, will be when where the viruses look different enough, and at the same time, over time, the effectiveness of the vaccines decays, but that's suggested to be between about 1 and 3 years. So I would say boostering right now looks like maybe 18 plus months in seems to be worthwhile, and that debate still rages on.
Well, Ben, unfortunately, we are near the end of our time for this episode, but I wanted to thank you for taking the time to check in, visit with me, and kind of bring us up to speed where we are and where we may be down the road. I look forward to continuing this conversation.
Yeah, thanks. I appreciate it, Tom. Take care. Stay safe.
This is Tom Fox again. I'd like to thank you for listening to this episode. I'd also invite you to listen to one of the newest podcasts on the Compliance Podcast Network, Effing Argentina. Are you exasperated with the current state of American life, overwhelmed, overtired, overworked, over cell phone? Well, this is the podcast series for you where, along with author Greg Greenberg, we take a look at, exasperation in 11 stories that Greg published under the book title, Effing Argentina. So check that out on the Compliance Podcast Network. It's also available on YouTube.